So you guys, Kim Bauer was an actual regular human teacher. She's still a human teacher, but she doesn't teach like scholastic stuff. She actually teaches equine and canine therapy and acupressure, trigger points. She has a diverse toolbox of modalities, and so she's here today to share with us her wisdom and her life experience, and her website is animaleasetherapy.com. So, welcome. Thank you for coming today. I'm so happy to have you.
Well, thanks for having me. Yeah, and I just want to say it's Animal Ease Therapies, IES, for the
Yes,
website. I mean, you might find it, but um, mostly because when I was trying to come up with a name for my business, I didn't want to just say acupressure because I was doing more than acupressure. And, it's kind of like people that come out with a massage certification and then they delve into other modalities. And so I figured Animal Ease Therapies kind of encompassed the things that I'm continuing to study.
absolutely. And it's a never ending story, right? When you're in the holistic animal field, it's just like a layer after a layer after a layer. And I love that about you and Lola. So I met you with Lori's dissection and got to meet the crew. And you guys are amazing. You're doing such amazing work and certifying people and creating careers for others. Like you yourself went down a conventional academic career, and then you suddenly ended up in the holistic animal space. So how fun is that?
Yeah, yeah. And for me, it was the kind of thing, my dad was a teacher. And so I grew up as a faculty child in Seattle my parents worked at a private school and my dad taught there. And I sort of vowed that I was not going to follow in his footsteps. I was going to do something else and tried some other careers, worked for a law firm, or did some PR stuff, and then was like, you know what? Teaching sounds pretty good when you have 3 months off in the summer. And yeah, so I actually managed to get a job in Portland at a private school that you didn't need a teaching certificate to teach at a private school. And then I went and got my master's degree in teaching at the same time and did my student teaching there. Um, and I loved it. I mean, I love teaching, but and then I moved to where I am now in Oregon. I'm up near Hood River. And I love the teaching, but it's just kind of the bureaucratic stuff and the state testing that wore me down. We have 10 acres here and I have some horses, and they're really what launched me in this direction was one of them had some health issues, which he was an older horse and he probably now would be considered like sleep deprived. Um, and so I was interested in taking classes to help him. And at the time, there was the Whole Horse Journal, which was a publication put out by Diana Thompson.
Yes.
Do you know her? Because
I
she's kind
don't
of,
I don't know her personally, but yeah, she's been kind of an icon, and she started equinology, didn't she?
she didn't start equinology, but she does teach there. So Deborah
Okay.
Ann Patillo owns equinology. But yeah, Diana has taught acupressure there forever. But she has her own ranch in Santa Rosa, California,
Right.
and teaches out of there. And that's actually the first person I studied with. So she was my original mentor. And she came up to Oregon and did a couple clinics, and then I hosted one, and I was totally hooked. I mean, I came home after the first one, which was probably in the late 90s, and worked on my horse and, used some flower essences that I learned about and some acupressure points and some massage. And he did his usual kind of stumble around sleepy thing because he was in his 30s. But he did this big like draft horse stretch and he promptly lay down and took a nap for like a half an hour.
Oh,
And
how
I'm in
cool.
tears and I'm like running around trying to take a picture but not wake him up because he would not lie down because I think he was afraid my other gelding was going to mess with him because he had. But anyway, so I was totally hooked after that. I'm like, oh my gosh, it really works.
Do you remember what flower essence?
I'd have to look. I mean, I have a journal of it, but so I work with the Bach flower.
I
Some
love
people say
that.
Batch. I've always said Bach, but
I've always said Bach too.
okay. Well, then we must be right. Um, and so I have the kit of 38 essences, and I use those frequently, and I used them a lot with my horses. And I think probably what I used was like Mimulus and Aspen, which both deal with fear, and so there's fear of the known and fear of the unknown, and Rescue Remedy. I think,
The most
again,
famous Bach
yeah,
flower.
Right.
And
Anyway,
you know the
so that was
history of Bach? Did you study Bach flower?
I did with Diana. So I
Oh,
didn't like do anything with anybody in the UK or any of that, but I do actually have a continuing ed class on Bach flower essences. It's not a professional certification, but that's one of the courses that I offer through it's housed on Lola's platform. So that's approved for continuing ed credit. Just because I
awesome.
feel like so much of what is going on with our animals has an emotional component, right? So there's the whole mind, body, spirit aspect of what I do with my work. And that's where acupressure comes in so well because, the different organs have different emotions. And so it's just kind of a win-win if you can approach it in a multimodality way.
I love that. Yeah, so suppression. Suppression is like the root cause of so much, I think.
Yeah. Well, I never really heard it put that way, but I think you're right, is that and, horses are maybe different because I think your membership is both small animal and equine or all animals. Is that
Yeah,
so? I feel like sometimes our companion animals that live with us have an issue with our own stuff. I mean, I saw that so much during COVID with my clients, and I would go to work on their dogs, or their cats, and it was just they were picking up on so much of what the humans were feeling during that time. Um, Horses, I think, have their own stuff, and sometimes it's from their owner, but other times it's just from how they're housed, or, if they don't get the herd environment or they don't have a friend and they're sort of in isolation.
right.
Um, yeah.
Absolutely, because they are social, herd-based animals. It's interesting when I got my divorce, I was in a pretty rough marriage with a little maybe domestic violence, you would call it. And I thought when I divorced, my dog would be really happy because the stress of that lifestyle would went away, totally went away. And he actually missed my ex so much. I was so surprised by that. And it broke my heart because I was like, wow, he didn't view it like I viewed it.
Yeah, they probably had their own relationship, like your dog had a relationship with you and probably saw stuff that he shouldn't have, but then also had a relationship with your ex, and that's the whole thing of letting we can't always understand what the animal, what their viewpoint is or where they're coming from, and that's why I like the flower essences so much, and along with acupressure, is because it's an individualized approach, right? There isn't one essence that's going to help every fearful animal. It's like, well, what is it rooted in? Like, is more of an anxiety, or is it more, I've got to get you before you get me, like fear-based? So there's the subtleties that come into play when working with animals under kind of that lens.
Yeah. So you acupressure with the Bach flowers?
Well, I use them in conjunction. I do actually have a book um, called Floral Acupuncture, which is for humans, but it talks about um, flower essences and putting them on specific acupressure points
That's what I was thinking that you were doing with the Bach flowers, but how are you administering Bach flower?
orally.
Poorly.
Yeah,
That
so
was it. No ear tipping, no.
no, I do use it topically, like for some of the fearful dogs and horses. Yeah, ear tipping for sure, or rubbing it on the chest. Um, but a lot of times I'll make up a mixer bottle. So especially if I'm doing a custom mix, so I'm mixing some different essences, then I will use usually Rescue Remedy and then a couple, two or three other essences in a spray bottle, which has water. Um, because, it's sort of like homeopathic remedies. It is still effective even if you're using like 6 drops in a couple ounces of water because it has a vibration to it.
So, and that's the beauty about Bach, is Bach actually was a student of Hahnemann.
Yeah, right. Yeah, you're
So
right.
I get so excited about Bach because I feel like he took Hahnemann's foundation and busted through his ceiling on that. And he was also doing bowel nosodes.
Oh, I didn't know that. Huh.
Yeah. So
He
Bach,
was way ahead of his time.
he was so ahead of his time. He was like into the fecal microbiome transfer in a way, but he was using it as a nosode. And so why aren't we doing that? Maybe we are. Janice, you would know. Janice is actually our licensed homeopath here. And
Mm.
so she can chime in later. Unless you want to say something. I notice you're unmuted.
No, go ahead. I'm fine.
Carry on.
So yeah, Bach was a, a holistic genius.
Well, and he was a medical doctor, right? Who was getting frustrated that his patients in the hospital, that some were getting better and others with the same disease and same treatment weren't. And that's where he thought, okay, there's an emotional component. And he started making sun tea with little different flowers or, branches of flowers and experimenting. I mean, what a cool thing.
That and then the power of the sun on top of that, like this simple but yet powerful process. I think we overcomplicate things.
Oh, totally. And or mixing things synthetic when it doesn't need to be. It's like, let's stick with the natural. And, there are different, like, I live in the Columbia River Gorge, which has its own unique flowers. And there are people that make local flower essences for people here. And I taught in Australia many years ago, and they had the bush flower essences. So there are other ones beyond the Bach ones, but so there are some, you know, places that get it and are sticking with it, but it's not mainstream, I don't feel, which is
Right. And I always
unfortunate.
get a little nervous about I want to support local, but I worry about their practices, their clean practices.
Yeah. Yep.
So I'm always a little leery on that. What do you use? You just use straight Bach.
Yeah. Yeah. I mean, the local ones I use, I know the person locally who does it, and I use like a topical. So she has a miracle healing oil that my massage therapist uses, and it has like arnica and calendula and some other things, but I'm not taking it orally. I'm just rubbing it on spots.
Well, that sounds awesome, though.
Yeah.
You're like rubbing it on your ears.
Yeah, or if I have like a bruise or something, I'm rubbing it on that, or yeah, or if I get, injured or something.
That's amazing. So when you remove the stress component, the emotional, mental, so I always think that there's emotional, there's mental, and there's mindset. Do you take that in consideration, or do you just kind of like lump it like this horse is a little like depressed because he lost a friend, and this one's mad because he was abused, or how do you go about that?
Well, so that's where the acupressure comes in. So the assessment piece of acupressure is called the four exams. And so it uses kind of all of your senses. So the first one is to watch them. So to see when you go to see the animal, and I'm mobile. I prefer to go to where they are to see how they're coping in their environment. Um, and so, because I started with horses, that makes sense. Dogs, I usually go to their houses, although COVID, presented some challenges, but we just worked outside or in the garage. Um, but so observing just their overall demeanor as well as how they're standing, how they're moving, if my eye's drawn anywhere. And then they utilize listening and smelling. So if there are any unique smells on the body or near the body, which usually, if you smell something, would indicate heat. But there are the five elements in acupressure. So there's fire, water, wood, metal, and earth, and each one has a unique smell. So this is like a sorting mechanism. And then the hearing is, listening to respiration, gut sounds, but also, are they overly vocal? If they're making a lot of noise and it's loud, that's usually more of an excess condition or a yang issue, where if it's like if you can picture an older dog that has kind of a weak hoarse bark, that's more of a deficiency. And so that's more yin like. And then you get a thorough health history. Sometimes I get it ahead of time. I usually prefer to get it after I've had my hands on the animal because I don't want to be influenced by, oh, there's something going on in the right front shoulder. And then I, feel like I was led there. I want to let it kind of unfold. And then the last piece is the hands-on palpation, which involves all over feeling for hots or colds or lumps or, sensitive spots. But then the bladder meridian, which runs along the spine and starts the inner corner of the eye, goes, and it's bilateral, and it goes to the hind foot. All along there are what are called the association points. So each point from right behind the withers to kind of by the sacrum is related or associated to an internal organ. And so by checking those, like bladder 13 is the first one. So basically that's right behind the withers. And so the lungs are below there. So there's a branch, a nerve or whatever that goes down there. I can assess how the lungs feel by that. And then there's an emotion that goes with lung, which is grief. So if I'm getting enough patterns, so I'm looking for patterns of disharmony. I'm not saying this means that, right? Does that make
Right.
sense?
But this is so exciting. I love this. I'm like tripping out here. Are you guys tripping out? Because I am. I'm super excited to hear this. That's amazing. And plus I got to do that dissection with you. So my mind's going back to that dissection, how you guys were making your little comments throughout the dissection. I was trying to listen a little bit, but that is so cool. So lung and grief go hand in hand, which
Yep.
doesn't
So
mean it's a diagnostic. It just is kind of like a weakening or a potential for that mental state.
right. So the way that issues can occur in traditional Chinese medicine, or I'll probably say TCM because it's shorter, is there can be external pathogenic factors, which to the ancient Chinese that lived in harmony with nature, the external pathogenic factors are things like wind, heat, cold, damp, so dry, so things that come into the body if the body is has a weakened state or a weak immune system in our world, and it allows that pathogenic factor to come in. So initially it's superficial. So it would be like if we get the flu or we get a cold, we don't feel well, we're kind of achy or we have chills, but it's not going deeper in the body. We can usually recover pretty well, right? If our vitality is strong. Um, and so what we're doing, and the other way that you can have an issue in the body is from an internal pathogen, which they associate with the emotions. So if grief goes on too long, so maybe the animal was sent to a shelter or, a rescue, and they don't know why. I mean, I see this all the time when I work with dogs at shelters. Most of them have kennel cough, right?
Right.
So to me, they're grieving and their actual lungs are impacted because that's the emotion that goes with it. And so if that emotion goes on too long, then you can actually have organ it can be at the level of the organ, right? So it starts superficial. So there's the external stuff that can come in, there's the internal stuff that if it isn't resolved or it's allowed to go on too long, can start to create issues in the body. And then the other way is, like trauma or, you eating moldy food or, so there's something that my mentor called neither here nor there. So there's external, internal, and then the other kind of random ones. So when I'm assessing, I'm not necessarily saying because I feel something on the lung point, which is bladder 13, I'm not necessarily saying that animal has grief, but I might see things like they might sigh a lot, or the lungs also govern the exterior of the body. So I might see a dry, patchy hair coat. So they're not getting enough fluids to the surface of the body, or the orifice that goes with the lung is the nose. So I might see nasal discharge, or there might be a cough or something to do with respiration, right? So I'm looking for patterns. And then the other piece is there are 12 main meridians. So these points I'm assessing on the spine have the correlating meridian. And the lung meridian starts in the pectoral area and goes down the front leg. So I might also have an issue on the front leg.
As like a lameness, a physical
Yeah, like
manifestation.
a check ligament thing, or there could be something going on with, so yeah, I taught a class in South Carolina a long time ago, and this horse had really bad allergies and was super itchy and had to wear like a fly sheet all the time because it would just rub itself raw. Well, when it was young, they'd cut the check ligaments. It's like, well, you cut right through that meridian, and guess what? You created this issue. Like, who knows if the horse would have had allergies if that hadn't happened early on?
Kim, this is so fascinating.
Oh yeah, don't get me started. I could talk for hours.
Girl, unleash it. I want to hear this. And and now I want to take your class. Now I'm like, oh my gosh, one more thing to do in my life, one more bucket list item.
Well, there you go. Yeah. So, okay, so to because I sometimes forget that I haven't like sort of set the stage. So there's 12 main meridians. There are six that are yin, six that are yang, and um six begin or end on the front for us on the hands and come up to the, up to this area. And the other six begin or end on the feet. So, like, lung starts in the chest. So, there's a branch from the physical lungs out to the surface of the body. And the point we access is lung one. Okay. And then that meridian goes down the medial side to the thumb. And then the sister is the large intestine. So then I go right next door to the second finger and I come back up, but on the outside. So they're like the mirror images. And the large intestine comes up to the nose. So there's this ribbon of energy running through the animals. And there's a time of day associated to each one. So 3 to 5 a.m. is lung. So if you have a dog or a cat that wakes you up in the middle of the night and it's coughing or it's sneezing or it's doing something, that's an indicator. It doesn't mean it's necessarily a lung issue, but if you start seeing other things like, there's dryness, there's nasal discharge, all that, they may have the beginnings of a lung imbalance. So it's like a continuum, right? It's not like, oh, now it's this. It's just like if we don't address it, it starts going deeper into the body.
Well, and then you don't know if it's a mental component or an actual physical manifestation of the lung. It's just so fascinating because negative emotions are toxic.
Right.
They like evoke this like acidic, weird taste even in your body.
Which is probably why there's the smell associated with them that I mentioned earlier, right? Because then they're excreting that or sweating that out. And
yeah, I never even thought about that. That's so cool.
so, yeah, so there's the six yin and six yang. So each of the yin ones, so that's like lung, heart, pericardium, kidney, liver, spleen. So they're considered to be a little bit more vital organs because they create substances for the body. Whereas the yang ones are like stomach, large intestine, small intestine, bladder, gallbladder, and then a one that's unique called triple heater that isn't an actual organ. But those are all like hollow or tubular, like they just move stuff. So, and they're paired. So lung is paired with large intestine. And so, there's a book by Cheryl Schwartz called Four Paws, Five Directions.
Yes.
And and it's a small animal acupressure book. But she's got a great kind of way the day goes is you get up from 3 to 5 and in theory you should be doing your tai chi or qigong breathing exercises to really help your lungs, and then you go to the bathroom, so that's large intestine, you excrete things, and then it's stomach, so you have your breakfast, and then it's spleen, and then it's so there's this energy throughout the day where for 2 hours at a time the chi energy is concentrated in each organ system. So if you have an animal, like I had one of my students just sent me a message earlier today. She brought back a Baja beach puppy, and they've had it for 8 weeks. And she noticed that it was vomiting bile or having hiccups between 7:30 and 8:30 in the morning. And then she went, "Oh, that's the time of the stomach energy." And when stomach chi rebels, it's vomiting or hiccups. So stomach chi is supposed to go down, right? Everything comes into the stomach, it's digested, and then it goes down to the intestines. But if it rebels, you get vomiting, although horses don't vomit, but you can have hiccups. So she was so excited that she'd remembered that about her dog. And so she did some acupressure points on her. And she said it was pretty cool. She hasn't done it since.
That's amazing. And what's the emotion to the stomach?
So the yin organs mostly have the emotion. So stomach and spleen are paired. Spleen is worry or overthinking. So a lot of times rescue animals that are worried about when their next meal is coming from, they like scarf down their food and then they throw it back up because they maybe were fending for themselves or their mom couldn't properly nurture them. So yeah, so and what you get is this kind of heat in the stomach, right? And it's like if you have a dog or a cat that's eating random things like paper or rocks, it's almost like an irritable bowel or a it's a digestive heat, and they're trying to quench that heat by eating random things, which is not doing what they need.
So I don't have a spleen. I got kicked by a horse when I was a kid. And I don't think I'm a warrior, but I'm a busy, busy brain
Well,
individual.
and that's the other, it's worry or overthinking. Those are
Yeah,
the things.
I am
You know,
totally an overthinker.
yeah. And so it would be interesting and you like so my mom doesn't have a gallbladder. She had it removed like over 50 years ago. She gets numbness along the path of that meridian. So do you get stuff along your medial? It's it starts on your big toe and then it comes up along the back of the tibia, medial side of the knee, and then it comes up like this and then it ends right on your like where your bra strap would be.
Mm, not, I'd have to think about it, but I don't, it's not obvious. I've had, like, when my immune system's compromised, I will feel like a big, like almost like a gout in my big toe. And that went on for like maybe a couple months and then it left. But it's interesting. So I think if something weakens my vitality, my life force, then maybe I do feel that. I have
Yeah.
to ponder it though. Yeah,
Yeah.
interesting.
Yeah, so usually I'm always asking about the location of things because it's like, okay, what meridian run like a dog that has lipomas, okay? So do they correlate to specific acupressure points like stomach and they're getting too much damp food, like stomach spleen, or where else is it? And so sometimes the location as well as the function of the organ helps put all the pieces together so then you can pick points to help address the imbalance.
That is amazing. That is so cool. I love
Well, and
this.
how did the Chinese come up with this thousands of years
I
ago,
was
right?
wondering that. I was like, who was the guy that was like, let's just figure out these things? Like Jinsen Jetsu, where that guy was on his deathbed and he just started hitting points and rebalancing his body. And it's a very similar thing. It's not the same thing, but they have kind of a similar concept. Do you
Well,
use one hand or two for your
I
acupuncture?
always have two hands on the animal, so I have like a connection. Um, Sometimes I'll do uh, points at the same time, like there's points in the neck. Like if I have a horse with wobblers or something that's, going on in the neck, I will hold one on either end of the cervical spine with the intention to bring the energy through. But otherwise, one hand's often just doing passive touch, and I'm using my thumb or my fingers on another point. And the points are the same as what are used in acupuncture, but I'm not using needles, obviously, because I'm not a vet. And the beauty of doing acupressure in my mind is it's my own energy mixing with the animal's energy. And so I'm getting a sense of when I feel that point, is it feel cool and empty, which is more of a deficiency, and I'm trying to bring like hook the chi or bring the chi to the point so it warms up and sometimes you feel a pulse, or is it like painful and stuck, kind of like a trigger point would be, and I'm trying to disperse the energy. So the strategy is going to be different depending on what I feel. But I also get the sense by working, one point or two sometimes together, is which point really resonated with the animal. Because with acupuncture, cumulatively, it's great. But I know, like, if I get a needle stuck in my foot, like liver three, and that zings, and I'm just like, and I'm not aware of the other ones, right? So it's to me it's more of a conversation between me and the animal if I'm just doing a point or two at a time and I can adjust my pressure and I can adjust how long I'm there based on their feedback.
Thank you for bringing up the acupuncture and the zing. So I personally do not do well with acupuncture. Like any needle zings me. I'll just like take it out right now. This is not okay. I break out in a sweat. I'm like, let's get this out, like I'm out of the table, like I'm off. And so I love the idea of having this like relational instead of a metal. Yeah. This
Well, and I feel like the animals get to have a say, right? It's not something I'm doing to them. They didn't make the appointment. So the person's like, yeah, you can do whatever. And I'm like, well, that's not the information, not the message I'm getting from your animal. And so in some cases, I might do, there's a point called pericardium 6, which is a really powerful point. For horses, it's right in front of the chestnut on the front legs. And
oh,
on us, it's right here between the tendons, like a couple finger widths down. It's where people put like the seasick bracelet. So pericardium 6 is called the inner gate, and the pericardium, since it's the heart protector, is basically helping us build trust with the animal. So I will sometimes start with that to let the animal kind of know we're having a conversation here. You can say no, you can move away, you can say, I don't like that. Um, and it's really good for rescue animals. Like a lot of times I'll have my clients that have adopted a dog from the shelter or, rescued a horse, have them do that. So they're building that interpersonal trust with the animal. Um, so yeah, so for me, acupressure works really, really well. Acupuncture has its place sometimes, but in a lot of cases, I feel like it's being done more formulaic. Like it's a cookbook. Okay, they have this, so we do this. Whereas it's not necessarily presenting the same. Every dog that has hip dysplasia does not have the same presentations, right? And
right.
they may have pain in different areas. And so I'm going to hopefully try to zero in on what their body is telling me is going on with them, because the body doesn't lie, right? I mean, that's the roadmap we have to try to decipher how we're going to approach what we find.
It's so cool. Um, I wanted to talk to you about there was something you said earlier, and I'm kind of blanking out in regards to the pulse rate. So I know in Jinshin Jitsu, you're like literally holding and waiting till the pulse rates. That's how I was taught,
Mm.
at least, is you want the pulse rates to be equal between your 2 points. Are you, is that your accomplishment? Is that what you're trying to do? Or yeah.
No, that's not what I'm trying to do. But so a couple things. One, there are pulses and tongue diagnosis that are part of the assessment. I'm not as proficient as pulses. You pretty much have to follow someone around and have them say, this is what I feel, because the pulse is taken on the horse's carotid or on the femoral on dogs. And there are, like, if you've ever had acupuncture, they take them on your wrist, right? And they're doing it on the lung meridian. So there are three superficial on this side and three deep, and three superficial on the other side and three deep that correlate to the 12 meridians. So one way to get more information is to see what the pulse feels like in each of those positions. So you can be like, oh, well, it's bounding in the liver position. I need to do a liver point. Um, but when I'm feeling a pulse in the point, to me, it's more, I'm not like counting it or anything. I'm just feeling that the energy has now arrived to a point that didn't have it before, or it was stuck there and now it's kind of moving through.
So you're just going for normalcy, like
Yeah.
whether it's stagnant or excited, you're just trying to get it normal.
Yeah. I mean, I'm not trying. So there can be excess, there can be deficiency, there can be stagnation, and I'm just trying to get things regulated. And in theory, in China, the Chinese medicine doctors got paid to keep their clients healthy, right? So it's more preventative. Where and then if you got sick, they didn't get paid because clearly they didn't do a good job, right?
Oh, interesting. Yes,
Yeah,
it's healthcare, not sick care, whereas
yeah.
we're based on sick care.
And
But
so
that's funny
I
that
have a
you're like,
number of clients that
no
have
money
me.
for you.
Well, I have a number of clients that have me come, every 4 to 6 weeks to keep their horses healthy. And same with some of my older dogs. And then I have clients that just, call me when there's been trauma or an injury or surgery, and we get them going. And then I only get called if something changes. So most of them are pretty well, so I've been, doing this for over 20 years. Most of them are pretty well versed. And if something changes, we want to jump on it sooner. So I'll get, one of my dressage clients will be like, he's holding his tail to the right. Can you come? So it's just like the little things where we can just nudge them back to balance versus wait months. And now we need to work, many more sessions to try to bring the body back to balance. And if you have something like medication involved, right? So if you have antibiotics or anti-inflammatories, those have their purpose, but they're bringing cold into the body. So now I have to deal with
Oh,
that,
interesting.
right?
So that's considered cold,
Yeah, because it's
suppressing.
yeah, and it's trying to get rid of the heat that was created, right? So that's adding cold, but it's like false cold, right? So then the body's, it's like a lot of us when we're on antibiotics or whatever, we get GI upset because of the body's all of a sudden the gut has too much cold in it, right? So it's easier to maintain than to try to play catch up. But not everybody's gonna, be able to afford doing that. But a lot of them are finding if they pay the money consistently, then they have a lot fewer vet bills.
Right. Absolutely. Preventative care, healthcare.
Yeah, right. Yeah. What about that? That's a concept.
This is so fun. I am really enjoying this. And so, on the emotional state of a dog, here, a dog's a little different than a horse. And I don't know the anatomy of a dog like I have been exposed to with a horse. I hear that you and Lola are going to do a canine dissection class, and I really want to know when that might be happening just so I can do the iridology. Hopefully, you'll let me do that.
Oh, yeah, absolutely. Yeah.
Yeah, thanks.
I wouldn't say it's happening anytime soon. It's still just a pipe dream, but
Yeah, it's a touchy subject. People don't want their dogs dissected.
well, I think the hunt club, the Woodbrook Hunt Club, where Lola does the hunting with the hounds, would probably be the best bet because they've got a ton of dogs. And when it's time for one to pass on, I think they'd probably be
Donate.
up for that. Yeah.
Yeah. Yeah, that would be quite the gift. So, because their dog's GI tract is so much shorter, I don't know about their pericardial sac, like the horses being attached to the sternum. Is it the same?
I don't know for sure. I would predict it's similar,
I would think.
but obviously there's a lot of variations. And so, that's the thing with the acupressure points. So when I was talking about the points along the back to assess on, they have been transposed from humans who have 12 ribs to horses that have 18 ribs to dogs that have 13 ribs. So the placement's slightly different, but they're still in the same order. So when I'm assessing, it's lung and then it's pericardium and then it's heart, and those are all three above the diaphragm, right? So that's kind of the upper portion of the body, and each of those has an emotion. So there's the grief with the lung, there's the trust with the pericardium, and then the heart deals with joy, but which is great, but too much of it is that mania. Like you see the animal or the horse that's just kind of like out of their mind, whites of the eyes, not in their right, all those things we say, they're not in their right mind.
Big energy.
Yeah. And so that goes with heart. And then after the diaphragm, then we have liver, and the emotion with that is anger. And then we have gallbladder, even though horses don't have a gallbladder. And then we've got spleen, which we talked about as worry or overthinking. And then we've got stomach. And then there's one called a triple heater, which basically divides the body into three regions. So there's above the diaphragm, below the diaphragm, and then everything like the intestines and all that. And it's unique to TCM, and it's kind of like the end system. So it orchestrates moving fluids around the body and deals with the ability to adapt to temperature differences.
It's
Um,
so random. Like I have such an organized thought. Like I'm thinking, okay, diaphragm below, it must be the limbs, but no, it's not. It's just a random place.
right. Yeah. Yeah. And then
I figured that out.
you got your kidneys and your large intestine, your small intestine, and your bladder that finish it off. And kidneys, the emotion is fear, right? And you go into the fetal position, right? And so that's like the psoas muscle ties into that. Um,
Well, and
And
when dogs are scared, they squat and
yeah, and they do the submissive peeing, and in TCM, the kidney and the bladder are paired, and the kidney controls the bladder. So if you have a fearful dog that is submissive peeing, you want to be doing both kidney and bladder points.
and then what's the difference between acupressure and trigger points?
Well, so trigger points are kind of trigger points, I think, came along later. I mean, they're defined as sort of a hyper irritable spot in a muscle, in skeletal muscle. And it could be a couple muscle fibers or it could be a number of muscle fibers. And they have, they refer, there's a pain response, and they either refer around the point or there are some mapped out ones. Like, most of us, if we push here and you have a trigger point, it'll refer up your back of your neck. So it's in your
Yeah, that's like
trapezius.
the Vulcan death grip,
Yeah,
that area.
exactly.
Yeah.
Right. And so that would be a trigger point. And so in acupressure, they were called she points, which was when they pushed on them, they'd be like, ah, yes, that's the spot. I think of it as, shit, that really hurts. But, so the she point is basically a trigger point. They weren't calling it trigger points, but those can show up anywhere. So they aren't always related to an acupressure point or a particular meridian. So it's just showing there's dysfunction in an area. And if you find that, you want to address it because they don't go away on their own. They need manual therapy, which is usually like direct pressure and then release for a little bit and direct pressure. So you're kind of like priming the pump. You're breaking up the contraction that's sort of stuck, and then letting new fluids and blood come in to lubricate the area. And then you kind of need to stretch it so that those fibers elongate. So there's overlap, but they're kind of like two different languages.
Right. And your goal is to get that to soften and just get pliable and relax. Are you doing two spots at the same time on trigger points, or just like grounding yourself and connecting with the horse and still priming the pump, as you say?
Yeah, I'm still two hands on, but my one is just resting somewhere and the other one's doing the work. And then when I stretch, I'm using both, depending, if I'm stretching a limb or whatever, then I need to make sure I'm keeping all the joints in alignment. Um,
And do you use any modality like herbs or essential oils or Bach flower while you do that to help like wake up those fibers to
that's
relax?
not something I have done. I don't see why you couldn't. I know enough about essential oils to be dangerous, and usually when I use them, like with my own horses, I just offer them to them. I don't put them on them because I have I have an issue with putting things on animals that they can't get away from.
That's smart.
That's just, and if like for mine, I don't have horses right now, but when I did, they lived outside. So I was worried about, what if they're out in the sun or, there's some kind of a reaction to something I put on them. And with a client horse, obviously, I don't want to do something that's gonna be a problem.
Yeah, some burning, some aggravation in
Yeah.
that regards. We had a veterinarian who does tuning fork therapy on, and she actually uses tuning forks on the acupuncture points.
I do that.
You do?
Yeah, so I have an Auto 128. So it's a weighted tuning fork, and the 128 frequency helps with like connective tissue and muscles, and then I have a amethyst on the tip of it because otherwise it's too pointy, it's jabby, and a lot of the animals don't like it. So I either use a rose quartz or an amethyst handle, which is easier for me to hang on to. And so yeah, I will use that on acupressure points.
Did you create that or did you buy it like that?
I, I bought the tuning fork separate from the
That
little
it was
crystal, but
stone.
there's some places that do sell them together. But at the time that I bought my tuning fork, I don't know if they had the crystal holders yet or not.
So does the crystal conduct more vibration? I mean, it's not really a stone, it's actually like quartz.
Yeah, I feel like it just is a nice conduit, and it's, there's different sizes, but it's about like that. And so it fits nicely, especially on horses. Some of the acupressure points are like the size of a quarter. Others are smaller, depending on the, like ones up on the face are usually smaller. But so it's a nice way to kind of cover the whole point, and then you can almost kind of angle it, because a lot of times what'll happen when you're working with animals and you're holding an acupressure point is they'll move a little bit to help you get deeper into the point. Like you think they're starting to shift, like they don't like it, but it's like I had horses where I'm doing a point on the back of the hind leg, and they three legs leave and that leg stays, but they're like trying to get me to get in deeper into the point on the back of the leg.
I love that.
Yeah.
That's so fun. Interesting you actually do it around the face. I never even considered that. I was kind of imagining what a train wreck that might be at my house. But
Well, usually if I'm doing it around the face or on the back of the skull, I'm putting my finger there and then
oh,
I'm putting it on there.
that
But
makes sense. Yeah,
yeah.
I think mine might run down the barn aisle, but I don't know.
Yeah, well, usually if I'm introducing them to the tuning fork, I do it, you ding it and I hold it far away from them, and then I come closer and then I come closer and then I put my hand and I put it on there. And if they're okay with it, I usually start like back in the sacrum and then can work my way forward. But yeah, some of them there's no way they want anything near their head.
Right. That makes sense. And I imagine just the vibration without touching them has some resonating movement within the body.
Oh, absolutely. Yeah. And there's different frequencies. I just use the 128. It's kind of a jack of all trades, but there are ones that, I don't know if it's a 256 or something that vibrates with bone. And that's like what EMTs use out in the field to see if there's a fracture. Like if they can't take an x-ray, it's like, well, this frequency, if they put it where they think there's a fracture, it will be extremely painful.
Really?
Oh, yeah.
I had no idea.
Yeah.
So that's actually a diagnostic tool when you don't have radiographs.
Yeah. I mean,
Um,
it has to be the right it has to be the frequency of bones, but it'll give you a pretty good idea of, yeah, we need radiographs now.
I feel like conventional medicine, the more I learn, the more I realize it just sucks. Like,
They're missing out on all these cool things where, you kind of giggle to yourself. You're like, oh my gosh, it really does work. Like, I mean, it's just,
why
I don't know.
isn't this common knowledge? Like, maybe everybody knows but me, but I don't know. That's amazing. That's so exciting.
Well, I think everybody's gotten so far away. It's like I mean, and here's, I probably should not get on my soapbox, but
Get
everybody
on.
likes gadgets, right? So there's so many body workers that have all these devices which have their place, but I feel like I want to feel it. Like,
I'm a hands-on person too. I have a Beamer. I don't use it very much. I kind of trashed it, but I want to I want to put my hands on them. Yeah,
yeah, and
I don't
and the
do anything that's electronic device.
and it's back to they can't get away from it. Like I know I was at a conference and there was a beamer blanket on me and I felt nauseous and I'm like, yeah, I'm not, because I've got clients that have them and they're like, oh, if 15 minutes is good, a half hour is better. And I'm like, no, don't do that.
No, because all that low resonance and it's pushing all the stagnation and the toxicity has to go somewhere. So that makes sense.
Yeah. But I think less is more, and I am trying to work as lightly as I can. So I like doing cranial sacral stuff, the acupressure, a lot of the myofascial stuff is so powerful. It doesn't look like I'm doing much, but that's the hard part is
That
being
is
okay
the
with
hard
that.
part. When I learned Jinshin Jitsu, I hated it because I'm just like this. And people are like, what are you doing? I'm like, it looks so stupid. And so I'm like, why don't you guys just do this? This is such a waste of my time because probably I don't have a spleen and I'm like this all the time. And so I'm like, I'm just going to sit here and hold these spots for a while and I'm going crazy, but it really works.
Yeah. Well, I know when I started, because, acupressure was what I learned first. And then I'm like, okay, I should probably learn massage because everybody knows what massage is. And so I would go work on horses and I'd be like holding acupressure points and my other hand would be massaging so that it looked like I was doing something because I was projecting what I thought the client wanted to see. And then I started getting clients say, can you come and just do acupressure? I'm like, yes, I can.
What a relief. Yeah,
Yeah.
that's good to know that people were totally okay with it because that's what I was doing. I was like doing pulse rate handholds, and people are like, "What are you doing?" I'm like, "I'm just sitting here feeling these areas." I'm like, "You actually could do this. So why don't you do it? And I'll do something else." But yeah, it just looks like nothing. But I think that's the beauty of our evolving of holistic medicine is I was exposed to some of the initial equine chiropractors that were really snap, crack, flop the leg in the air, pop the pelvis, and as much as that did help the horses in that day and age, it never took the whole horse in consideration. And so I feel like we were failing them because we were only addressing the structural bone aspect of it, and maybe some soft tissue in there because muscle moves bone, bone doesn't move muscle normally. And so when I felt like that stuff was failing, I went to more of a whole horse issue is, well, let's detox the kidneys and detox the liver. And then they'd go back in alignment from the detoxification because the inflammation of the organ was pushing them out of alignment. But you're going, so I was kind of reverse engineering it, and you're actually creating wellness where you don't have to reverse engineer it because they're never going to get there.
Well, hopefully, yeah. But I mean, there's some new clients that come in and it's like, oh gosh, where do I start with the layers, right? But listening to you talk also made me think of one other thing. So back to trigger points and the points along the spine I was talking about assessing on, because this happens with chiropractic, is if the adjustments don't last, or there's a trigger point, I release it and it keeps coming back in the same area and it's along the spine, usually it means there's a visceral problem. So there's something going on with one of the organs, and the nerves are coming off the spine there, and they correlate to the acupressure points. So I can be like, oh, well, this keeps coming back and it's right behind the last thoracic, behind the last rib, that's stomach. So maybe there's an ulcer, right? And then they have like a left limb, they can't extend their left front leg, and they're maybe a little side bent to the left. It's like, okay, that's a stomach issue. And it's whether there were ulcers or there are ulcers, you got to address those. And then you have to restore the mobility of that organ in order for all of that stuff to actually last.
So is that where you get more into osteopathy to
Yeah.
restore? And you do that also.
Yeah, I do some osteopathy. I do the functional indirect techniques, so not chiropractic. So if there's a barrier, I go to the side it wants to go. I go to the side of ease, not the side of barrier. So I'm not punching through it. I'm going, oh, you want to flex? Let's go more into flexion and then let it unwind and reset that way.
I love that. I always kind of cringe when I see these chiropractic classes where people are shoving the horse's pelvis down. And I'm like, oh my gosh, that's not cool. Like, that just seems so wrong to be like torquing a pelvis when what if the low one was the problem, not the high one? And it sounds like you could work around it and let it fall into place naturally.
Well, totally. And because I did learn some of those techniques and I was in tears. I'm like, I can't do this. This is not the person I want to be. But you can draw in osteopathically cranial sacral wise into the level of the bone and you can move it without thrusting. Like you can, if you sink through and use your intention to go through the layers of the muscle and then get to the bone, you can make it, it's going to be back to this. It doesn't look like I'm doing anything, but I can actually influence the movement of the pelvis by drawing into the cranial sacral rhythm and kind of getting the iliums walking the gait cycle where they're going like this. And then the kidneys move with that. And, whenever we walk, everything moves. Or if it doesn't, we got to restore that.
Restriction. Yeah.
Yeah.
Scar tissue,
Yeah.
congested organs, all of that. So fun. Oh my gosh. Anything else you want to say? Man, we are already at the 1 hour mark.
Oh, wow. Okay. Yeah, no, like I said, that's why I didn't present or didn't prepare anything anymore. I feel like I just kind of like to see where conversations go and, you know, yeah. So
I
this
know.
has been wonderful.
Oh, I'm thoroughly enjoying this. You guys, do you want to unmute and ask Kim any questions? I can change. our view to gallery. Is anybody excited about this? Am I the only one? Am I the only one saying, take my money, just make it my time? Any anybody? And I know did you work with Carrie Ridgway?
I did. I studied with him back in 2011. And he was such an amazing man. So he had his kind of myofascial units. So he used acupressure points, but they were slightly above. Like I talked about lung being here. He has a lung 1+, which will release most of the thoracic sling muscles. So he was onto some cool stuff. And I took the class and he was teaching to stick a needle in. And he's like, well, if you want to know how to do the acupressure, go talk to Kim because that's what she does. So that was kind of fun that I got to sort of help out a little bit.
That is fun. That is
Yeah.
amazing. What a compliment. He is an icon.
Yeah. Yeah.
He,
I have a question.
yeah.
So, if we wanted to find somebody in our area who does what you do, what would we look for? Not just an acupressure, but all the other things that you incorporate in it. Like, what would we look for?
So I usually refer to myself as a body worker
Okay.
just because that's what I'm doing. So, and or manual therapist. And can I ask where you are?
Nashville, Tennessee.
Okay. So there's an organization called the National Board of Certification for Animal Acupressure and Massage. The website is nbcaam.org. And
Remember
you
that,
could
Charlene?
you could look
NBCAMN
AAM.
AM
Yeah,
BC.
NBC, two A's and then an M.org.
Okay.
Which is so I'm a board member. I'm also certified by them in acupressure. So those are we issue national exams in either acupressure or massage. So people that have passed that have met a benchmark standard in there.
Okay.
And so that would be a starting place, and then you'd want to see if they've done additional training. Like they're required to take continuing ed. But so straight massage or straight acupressure probably won't be exactly what you're looking for, but you want to see somebody that's continued to learn other modalities, whether it's professional certifications or just continuing ed type stuff.
Okay. Cool. Or
Yeah.
any chance you're going to be visiting Nashville anytime soon?
No, it's funny though, because the horse I was working on today, the client is taking her parents to Nashville in May. And I
Oh,
thought,
wow.
maybe I can tag along.
I think you should go on a road trip.
Yeah.
I think we need to have like a holistic animal insight live conference. That's what I think.
That would be amazing.
Yeah,
Yeah.
I did think of somebody who's in Tennessee. I don't know her personally, but her name's Martha Stowe, Stowe.
Okay.
I just met her. We did a virtual conference for body workers last weekend. She presented, and so she has equine massage. Oh, you have a small animal?
Yeah, dog.
Well, you could see if she does dogs. I know she does horses because she has certification in animal massage and she does a lot of myofascial
Okay.
stuff. She was talking a lot about energy, and so she would be a good starting place, and or she might know a small animal practitioner if she doesn't do it.
Okay, cool. Thank you so much. Appreciate it.
Yeah, you
Charlene,
bet.
maybe you should learn it.
Yeah, take a
Maybe it
class.
should be your side gig.
Got enough going on. But hey, this presentation made me think about Callie. And you know how in our iridology, her bladder is continually showing up, even though her UTI, her urinalysis and stuff, like usually are all okay. I wonder if it's fear-based just from our living situation.
I wonder too. And as Kim was talking, I was like, how do I relate this to iridology? Like,
Yep.
this
Yep.
is so interesting. Now I'm gonna have to like reprocess this. And
Yeah. We can talk about that during our iridology class and combine all this. It'll be awesome.
I know. Right
So
on.
Well,
exciting.
and I know Poppy, I told you this at the dissection. I know the iridology is way more advanced than this, but in traditional Chinese medicine, the eye, there is a relationship to the organs. The eye itself is related to the liver. So like the health of the eye or, like jaundice or reddening is
Right.
related to liver. And then kind of the sparkle or the vitality, like if you look at a person or an animal and you're like, oh, like sometimes you see
Bright
older people
eyes.
that have this bright, sparkly eye and you want to go chat with them, full vitality. That's related to the heart. So the saying is the heart the animal spirit is housed in the heart and revealed in the eyes. But then there's also places around that tie into lung or kidney or whatever. I know the stuff you're doing is way more in depth and, comprehensive, but there's got to be some overlap, I would think.
I would think so too. I've heard Dr. Judy Morgan also do like a TCMI assessment. I was like, wow, that's kind of interesting. But it was close, but it wasn't close enough. But what I think is fascinating is I was drawn to like studying the human cell because a lot of our members are talking about like structured water and the fluid of the body. And so for some reason, I was just like, I'm gonna pull up a cell and just kind of study the cell. And it looked just like an iris. So I'm wondering if the overall iris is actually an image of cellular health.
Mm.
Some of those marks look like little mitochondria and stuff. It's very fascinating. I don't know. It's just a theory, but one more rabbit trail.
Yeah, well, those are the fun ones, right?
Yeah,
It
absolutely.
would be super cool, Kim, if we had you at our next iridology class.
Well, somebody tell me more about it and when and where, and I'll see if I can.
We meet here every first Monday of the month, and all the members get to throw up irises of their pets or their clients' pets, and we assess them as a group. We probably only get through like 4 of them, except for Charlene makes me stay late. So I try to keep it a little organized, but it gets totally disorganized.
So
But
it's in 2 weeks at the same time.
yes, 2 weeks at the same time. You can come. Lola can come.
Oh, all right. So what is that, the 8th?
It would be
Yeah.
the 7th, I think.
Oh yeah, so 7th would be a Monday.
Yeah.
Well, yeah, I would be happy to come if you'll have me. Just
Yeah.
send me
If
the
you
link.
want to do some iPhoto cases, if you have like your acupressure emotional congested organs on irises, we would love to see those.
Oh, I don't know that I'm not sure if I'm. Well,
That's a
let me think
tall
about it.
order. You're like, that's a tall order. I can't.
Well, no, I mean I'm up for it. I'll just have to see if I can get. I'm going up to Lola's this weekend. We've got to film some stuff, so maybe between us we could get some pictures of some of the horses up there.
Fun. And your classes are online, or are they in person, or both?
Both. So I have some CE classes that are online. My professional certification course in acupressure is online, followed by a 5-day hands-on practice.
That's so exciting. Okay, you guys, anything else you want to ask before we call it a night? Was this fun?
Yeah, it was a lot of fun.
I thought it was fun.
Yeah,
Thumbs up, you
I
guys.
just want to say thank you. My head is spinning with all the information that you've given. So that was a pretty fun talk.
That was
good.
that was one of our top 2025 talks.
Oh,
Thank you, Kim. We
You're
appreciate
welcome.
your expertise and your time, and in true teaching aspect, you made it very clear, because I've always been very intimidated by TCM. So
yeah, and it's a lifelong study. I mean, I'm still learning stuff and I've been studying it for, over 25 years, but what I try to do is make it, I try to chunk it up and make it, pretty basic, but yet give enough information. And then if you want to go down rabbit holes or read up on stuff, you can.
yeah.
Yeah.
We really appreciate your time. Hopefully you'll come back and maybe we'll see you on our iridology practice class.
That would be fun.
Right on. Take
Thanks
care.
for having me. All right. Night.